morning and welcome. We're going to wait a few moments and let our attendees log on and get settled. If I can remind, excuse me, if I can remind our committee members and guests, please check out your Zoom name display if it says DACLAC panelist. If you could please change it to your name, and the way you do that is there's 3 dots over your video. Click on the 3 dots and then you should see an option to rename. So if we can get you to do that, that would help us with who is attending our meeting today. Okay. All right, thank you very much. Welcome. I am Carol DeAndres. I am the stakeholder and public engagement manager for the master plan aging team here at the California Department of Aging. And we welcome you to the disability and we welcome you to California Health and Human Service Agency's Disability and Aging Community Living Advisory Committee, or DACLAC. DACLAC. It is Disability and Aging Community Living Advisory Committee. Today is May 22nd, 2024, and this is the committee's second meeting of 2024. So welcome. Now I'm going to go over a few of the logistics. So as everybody logged on, get settled, we can move to the next slide. We welcome you to this virtual meeting. We have closed captioning available to you through the Zoom application. We also have ASL interpretation available. Thank you, Tulip, and your colleague. You will see later in about 15 minutes, I think. And we thank you so much for your help. Today's meeting transcript, slides, and the recording will be posted on the California Health and Human Services Master Plan for Aging webpage in a few days. So please check back for the available materials. And again, committee members, invited guests to this webinar, please check your name display. If it says DACLAC panelist, please change it to your name by right-clicking and hitting rename. So we appreciate that, so we know who's joined us today. Next slide. Virtual meeting operations. We do have the chat function is enabled for committee members, California Department of Aging state staff, and invited guests to share meeting related resources and information out to our attendees. The public is able to view this information. The chat and the question and answer functions are not enabled for comments from the public attendees, but we do have a public comment period at the end of the meeting and we invite you to participate. So if you could please hold your comments until that time, we will have public comment at that time. And of course, you can send your public comments at any time to the Engage email box, which is engage@aging.ca.gov. Next slide. Just to go over how public comment will work here at the meeting, attendees joining by phone can press *9 on your dial pad to join. The moderator, myself, will announce the last 4 digits and unmute your line. If you are attending via the Zoom webinar, you have a raised hand icon, and please click that and we will call on you and unmute your line. Do take note that public commenters will have 2 minutes so that we can get to everyone. And of course, again, if you have additional comments, please feel free to email them to our Engage email box, engage@aging.ca.gov. Next slide. So I wanted to take a moment to orient us to the purpose of the DACLAC committee. The purpose of the Disability and Aging Community Living Advisory Committee, or DACLAC, is to advance community living, inclusion, and integration across California. DACLAC will ensure the involvement of individuals with physical and intellectual disabilities, older adults, and other partners who provide services or represent consumers. DACLAC will advise the California Health and Human Service Agency, CalHHS, in addition to other state entities on community living policies and programs, including but not limited to long-term services and supports, transportation and housing, and employment opportunities. Next slide. And of course, we could not achieve this purpose without our committee members, and we do thank them. This is a long list. These folks put in their time, their talent to help advance the master plan for aging and community living here in California. So let's go to the next slide and see our additional committee members. We have numerous committee members, and we do have a few new committee members that we will be giving a shout out in just a moment. But thank you so much. One more page of committee members. So thank you very much to all of you who have joined us today and in your work here on the DACLAC committee. The agenda, which is on the next slide. We have a packed agenda. This is a 3-hour meeting, 10 a.m. to 1 p.m. We will have opening remarks from our director, Susan DeMorris, and then we will have our report outs from our committees. If we go to the next slide, we'll have a break at 11:05 and public comment around 12:40. So without further ado, I am going to turn it over to the director of the California Department of Aging, Susan DeMorris. Susan, good morning.
Thank you, Carol. Good morning, everyone. Good to see those of you who are on the screen. We've got 61 participants today. Oh, good. I like it when I can see everyone. Thank you all for joining today, and a special thanks to our co-chair, Sherry Burns, to my state co-chair, Director Joe Xavier from the newly named department. Joe will be hearing later, and to everyone who's leading our work groups, whether you're chairing a work group, participating in a work group, emailing people on the work groups. We are so proud of how DACLAC is functioning and operating these days and being very effective through this work group model. And I just want to thank everyone for the time that you're putting in between meetings to lift up the important priorities and recommendations. It's really all culminating as we move towards the end of the year and the day of action and preparing for our next 2 years of Master Plan for Aging initiatives. So thank you, thank you, thank you. Looking at the screen, I need to move my screen to thank everyone, and to our CDA staff as well. Thank you for all that you do to prepare for these meetings. My comments are going to be very brief. There's a lot happening, including budget hearings today. I'm just going to share 2 thoughts with you. I am joining you today from the state of Washington. I just got to hear Washington State Governor Inslee talk to a group about aging and longevity. They are embarking on their first multi-sector plan on aging. They don't yet have what we have, but in so many ways, they have what we want. You know, they have the Washington Cares public long-term care insurance benefit, and it's just a great model of how we're learning from each other. I'm sharing tips about California's Master Plan for Aging, and I'm learning about home and community-based services and LTSS financing from our West Coast partners in Washington State. And it really just struck me that, you know, as we come up on the anniversary of the Olmstead decision, as we work through, you know, year 4 of the Master Plan for Aging, that this is a time when we really need to hold firm onto things that are enduring. that have been built to sustain us for many, many years, like the Olmsted decision, like the master plan for aging, because these are challenging times. And I'm so proud that in our state we do have 5 bold goals, and that this is the stakeholder group that's really working diligently on all 5 goals: housing, transportation, home and community-based services, equity, affordability. So I want to thank you for your work, and I don't want you to be discouraged in these very challenging and difficult budget times. There's fantastic work underway in our state, and there's fantastic work still ahead. So with that, I just want to thank everyone. Please stay with us, stay the course, don't become discouraged this year. And that's the lead into our undersecretary from the Health and Human Services Agency. I know the budget is top of mind for everybody, and you're closely following the governor's May budget revision. So we're so thrilled that today Marco Meach can join us from the California Health and Human Services Agency to provide us with an update on the governor's May budget revision and other thoughts. Marco, welcome.
Thanks, Susan. Hopefully you all can hear me okay. This
Yes, you
morning,
sound
I
great.
had all kinds of issues with the technology, so bear with me with regards to being able to navigate that. First, thank you to the CDA team in particular. Congratulations on 50 years of good work in the state of California and 50 more years to go. And so just a huge thank you to you, to our other departments who are part of this work, from social services to DOR to DHCS. Thank you for your commitment to the work that we're doing. And I'm so excited to also see Stephanie from CalSTA and other colleagues who are part of this work. This is a whole of government effort. Aging does not just impact us in the health and human services space. And I'm so grateful to Stephanie and others at CalSTA and our BCSH colleagues and others who really have come to the table in a pretty profound way to help us think about how we create age-friendly communities in a state. So I just am grateful. To all of you, also, thank you. The committee has looked very different from how this committee has structured before. And what I'm most proud of is that this seems to be a doing committee rather than just a talking committee. And so I am really proud and grateful to each of you for rolling up your sleeves and for really participating in the subcommittee processes to help us think about the challenges that we are contemplating. We can't do this on our own. This is not just a government effort. This has to be a whole of society effort, and we all play a role in it. And so the fact that many of you as stakeholders and partners are at the table and helping us think through these things, that's really important to me, and it's important to the secretary. And so I'm grateful for that. I see some new faces, and I see some familiar faces. Just for background, my name is Marco Meach. I work at the California Health and Human Services Agency, where I've been here for 9 years now, and almost 3 years as undersecretary. I have the privilege of working every day with a lot of people on the Zoom across the 12 departments and 5 offices. We have about 37,000 employees that serve you and the many, many other Californians across the state on a host of programs and services that are designed to help each of us live healthier and better lives in the communities of our choice. And so I'm really grateful to have the opportunity to do that. With that, I want to spend a little bit of time telling you about the approach that we took with regards to the May revision. And I want to start by just first and foremost acknowledging that these are difficult times. And despite the difficult times, I think that there is a lot that we can be proud of in terms of the progress we've made over the course of the last couple of years. When we looked to design the May revision and post the understanding of kind of how big the challenging fiscal situation looked, what we tried to do, or what the secretary charged us to do, was to really work with our directors to think about how do we ensure that we protect at least the core elements of the safety net. How do we protect SSI, SSP? How do we protect the core underpinnings of IHSS? How do we think about the Medicaid expansions? How do we think about CalWorks? How do we think about child support? And so our goal, I know there's a debate about what core means, and I'm not here to debate what a core program or core function means, but what we try to do is not take away people's underpinning benefits as part of this revision. And we got extremely creative in thinking about how we tighten our belts, just like every other state agency across state government had to do. Similar to what you and I do around our kitchen table with our significant others and our families when budget times are difficult, where we have to make adjustments to certain things. So our focus really was on trying to figure out how do we further delay certain things. How do we think about making cuts to the things that weren't out the door necessarily? These were very difficult decisions because these are all important things. No one thing is not important. And remember, we were the ones that put many of these things in place. And so cutting them weighed very heavily on each of the individuals that are on the Zoom, as well as myself and the secretary. But we had to make very difficult decisions, and we've tried to make them with some core values in mind that were guided both by our guiding principles and strategic priorities, as well as the work that we had done with all of you and others on the Master Plan for Aging. So I want to just say that at the outset. I know you all as advocates demand more of us. And that is okay, and I appreciate that, and I urge you to do that. I just hope that it is done in a way that is respectful of all of us. We too are humans, and we too did not want to make some of these difficult decisions, but we had to, because we had to do the responsible thing and present the legislature with a balanced budget. And so it is easy to point fingers or demand that we not do X, Y, and Z. I hope that each of you spend a minute just putting yourselves in our shoes, where we had to not think about one particular program, but the totality of our enterprise and our work across the board. And some of you may not like some of the decisions that we made, and that is okay too. And we urge you to tell us why you believe we did not make the right decision. But I would just ask you to do that in a way that is respectful of us as humans first. This weighs heavy on all of us as well, but we have to tighten our belts and really think about the trajectory of some of this work moving forward. The last two things I will say is that I think of our budgetary work as an arc of progress, and you take a few steps forward, and then you take maybe perhaps a few steps back. And when I look at the totality of our work over the last 5 years, undoubtedly, we have made incredible progress that no other governor in the history of this state, nor other secretary, has really anchored in the health and human services space the way this governor has and this secretary has. And the commitment of our directors, from social services to aging to DOR to DHCS, has been such that really people have come to the table and expanded our work in profound ways than we've ever had before. And so I just would want to urge each of you to think about this work as the arc of progress, that what we've been able to accomplish together is still the underpinning of this budget and this work. Yes, we've had to make some adjustments, and those were difficult adjustments, but the totality of our work, by and large, is still intact. And we are guided by the principles of the master plan and the work that each of you do. The last thing I will say, and this is what I keep telling our team, is that in difficult situations like this, we either have the opportunity to kind of revert back into our corners and begin to think about kind of the horrific scenarios that we are in, or we can take this opportunity and think about what the opportunities are that are ahead of us to think more creatively and differently about how we deliver programs and services. And so as a committee, as you begin to contemplate both the May revision and our work moving forward, I hope that this is a call to action around how we leverage the conditions that we're in today to ways in which we connect the dots much more strategically to leverage different programs and services much more holistically rather than in the silos that they traditionally are. That is easier said than done, so I do acknowledge that, but I also hope that people take the opportunity to think about what that ultimately looks like moving forward. And I think that in times like this, our innovative spirit, the opportunity that is ahead of us is something that really should be at the forefront of our thinking. So in closing, thank you for being here. Thank you for being an important part of the work that we do collectively. We cannot do this work without you. We cannot do this work in isolation. I'm extraordinarily proud of how this committee has evolved and what great work you have produced over the last year or so in terms of its reformation. I'm really grateful that it's a do committee and not just a think or advice committee. It really has taken on a different life. And as we go into the next couple of weeks, I hope that you give us the grace and empathy in terms of how we think and do some of these things. We come to this work just as you do about lifting up vulnerable people in communities that are disproportionately marginalized. And we have to make very difficult decisions. And so I just hope that as you hear from our department directors and their teams, that you keep that in mind and that this conversation and this space is a space of respect and a space of real bravery. I was recently at a Department of Developmental Services meeting where we talked about kind of creating the right space. And I will kind of close, and some of you were at that particular meeting where I had the opportunity to join in person. But I shared with them a quote or a poem from Mickey Scott B. Jones about creating brave spaces. And so I just want to read this to you because I think it's important. And I hope that we collectively begin to create the brave space for us to do this work together. So it reads something like this. Together we will create a brave space because there's no such thing as a safe space. We exist in the real world. We all carry scars and we all have caused wounds. In this space, we seek to turn down the volume of the outside world. We amplify voices that fight to be heard elsewhere. We call each other to more truth and love. We have the right to start somewhere and continue to grow. We have the responsibility to examine what we think we know. We will not be perfect. It will not always be what we wish it to be, but it will be our brave space together, and we will work on it side by side. So I hope that that gives you kind of the space to think about what we do together moving forward in these times. I certainly am open, Susan, to take questions from folks or feedback and comments. And just grateful to you, Susan, for your leadership, Sarah and the rest of the CDA team for being the backbone of this work. And I'm grateful to each of you for being here today.
Marco, thank you. And thanks for closing. That poem's been in circulation since you shared it. I didn't know you were the source, and we will call you Braveheart now. Thank you. We have time. I see Marty has his hand raised. We can take 2 questions, and I just really want to thank you, Marco. There are hearings galore happening, and you and your team at agency and all the agencies represented here are working overtime on the budget. So thank you for gracing us with your time. Marty.
Thank you. Thanks. Was that Susan? Who was just, I couldn't see her face.
Yes. Yes.
Okay. Be safe in Washington. Marty Yamamoto, I'm a dad and a family member of CDCAN, California Disability Aging Community Action Network. First of all, Marco, I remember when you first came to the agency, I swear I thought you were just like a teenager or some kid. And I've seen you grown over the years and, you know, in partnership, and you've been really incredible. So I just want to let you know that. Also, I was attending that meeting remotely at the Master Plan for Developmental Services at the first AME charge building in LA, and your opening there was incredible. And I want to tell you how much that touched all of us. You told your personal story of your family history. Some of it I already knew, but and then you reached towards the issues of equity and how we treat each other. And I just thought you set the right tone, and how much you moved everybody. And I thank you for that. All of us actually thank you for that. Lastly, just on the real world of budget, thanks for your summary. But I was wondering, on the 2-year budget, the governor was talking about a commitment towards looking at the budget in a 2-year, maybe a more formal approach. And I actually think that's a good idea. But I wonder how formal, you know, in terms of action from the administration working with the legislature, will that be? Or is that just because in theory, you know, we always project out 1 year and we go back 1 year, but this is more, it seemed like it was a more formal proposal, and I'm not sure how. I was just wondering if you knew.
Yeah, so I think that's a
Thank
very
you.
good question, and thank you, Marty, for your comments. So we typically budget on a 4 to 5 year window. Now, the legislature and we adopt a 1 year budget at a time, but we look at the multi-year across a 4 to 5 year span. So when our teams produce the budget, we get a multi-year perspective that we then roll up into what we present ultimately to the legislature. The governor in this particular go around wanted to take the responsibility to think about this so that we're not at a place where we're having to make deeper cuts or different changes in next year. And the goal there was to give people some certainty about what the future holds, because each of you who are doing work on the ground, it is hard to live on a year-by-year basis with the uncertainty and difficult budget times. A 2-year window really looks at kind of how do we create the balanced budget in that window of time so that you all cannot be distracted by worrying about whether or not this or that program will be cut, but really focused on actually delivering the work. And now we're in negotiations, as you all know, with the legislature around whether or not these are the right ideas and if this is the right framework. And so a lot will happen in the course of the next week. We are co-equal branches of government. They have the opportunity now to really dig deep into that and think with us around what the future holds. And then we'll figure out whether or not the architecture of that 2-year window really is going to be something that is memorialized. But our thinking really was the responsible thing to do was to think about how we anchor that in that 2-year window. And we continue to look at that multi-year as well, the 4 or 5 years out. It is always hard to project 4 to 5 years out. When I was at the federal government, I worked on the CLASS Act. I don't know how many of you are familiar with the CLASS Act. And one of the provisions in the CLASS Act was, you know, you had to actually assess whether or not the benefit, the insurance benefit was actually sound for 75 years. My God, you cannot make anything actually sound for 1 year, let alone 75 years, right? And so a lot has changed. And so I think we take that on one by one. So I hope, Marty, that answers your question in terms of what our thinking is on that.
Debbie, we'll finish off with you.
Oops, yes. Yes, thank you, Marco and Marty. And Debbie, we'll take one more question from you, and then we'll move to the next agenda item.
Thank you. So, thank you, Marco. I like Marty, remember, you coming to Health and Human Services, and I remember you teaching me for the very first time in my experience, and mind you, that was, what, 9 years ago. I had been here for 13 years, and you were the first person to truly teach me that government is not here to hold back the advocates, but to connect and lift. And your leadership continues to demonstrate that partnership and the values. And in these tough budget times, I just want to recognize, of course, none of us are happy with IHSS cuts. Of course, none of us are happy with what we're seeing right now. But I do want to express deep, deep gratitude that MSSP and adult day healthcare are not being eliminated. That is every single bad budget. That's the first thing to happen. And that's not happening. And that means that something has shifted in our government. And I want you to know we see you and we appreciate you. And we are going to continue to be the advocates that we are. And we're going to continue to go to the legislature and tell them these are not okay. And this is what we want to see happen. So, and I appreciate that this is the environment where I have to say I worry about how Susan, how Sarah, how you, how all the people that are leading in government and that are doing the right things, the Claires, that everybody who went from this side to that side and everybody who started at that side are going to feel when we come and advocate. And that is a very different culture in our government led by you and others. And I just want to recognize that and thank you for that. And also want to second the idea of including more years in a budget. I understand things aren't predictable, but none of us operate thinking about just this year when we plan our budget. So just truly deeply appreciate that and want to remind everybody in this space that the administration's budget is not the done day. We all have work to do with the legislature right now. So keep at it. Thank you.
Thanks, Debbie. And thanks, Susan, for your time. I'll listen in for a little bit longer, and I appreciate again the space. Please feel free to reach out to us, to our department directors and our departments on any of the budget pieces, and again encourage you to be part of the dialogue with us and the legislative partners as we kind of look to close this out. So thank you for your time.
Thank you, Marco. And I don't know that I fully appreciated and acknowledged our two stakeholder co-chairs at the outset. You'll be hearing more from them, Sherry Burns and Hagar Dickman. And then by name, our leaders on transportation, Michelle Rousey, Marty Emoto on housing, and Hagar doing double duty on HCBS. So we're just very, very grateful for your leadership and how you've stepped in to lead the way. And then I did acknowledge by name Joe Xavier, who is not joining us, but we do have Anna Acton with us from, I see your screen still says Department of Rehabilitation, but the department is being rebranded as Disability Works California. So like all of you, Anna now has two roles covering two departments. So with that, I will turn it over now to Sarah Steenhausen, who will facilitate the next segment of our agenda.
Thank you, Susan. And I see, oh, Marty, did you have a question right quickly before we move on, or did you not? I didn't know if that hand was old. Okay, sorry about that. I am so happy I get to introduce Hagar and Sherry, our two co-chairs, who have just done an amazing job in, as Marco said, this committee really has shifted to a very much of a working committee. And I know you all feel that very, very much. And I know it is a lot of work. All the time that you have put into trying to focus and identify your top priorities is really, really critical. And it will really help ensure that these highest priorities get elevated to inform the next iteration of the master plan for aging. I know how hard it is. It's messy process, but it really makes a difference. And I love that we are here to hear from you. You are not here to just hear from us. We are here to hear from you, to learn from you, to get the latest and greatest thinking on where those system priorities are. So I also just want to say how excited we are to have new members of our DACLAC committee. I'm so excited to have Carolyn Nava, Sabrina Epstein, Joe Perales, and Kay Lee, as well as Andrea Roberts joining us. So welcome to all of our new members. We look forward to hearing from you and to having you participate on one of our 3 subcommittees. And I'm really looking forward to these in-depth conversations that will be facilitated by our subcommittees as we hear from all of you in it right now. So I'm going to turn it over for intros from Hagar and Sherry. Welcome, Hagar and Sherry.
Thank you, Sarah. Good morning, everyone. My stakeholder co-chair, Hagar Dickman, and I are also very excited to have 5 new members of the DACLAC. Welcome to all of you. We're all looking forward to continuing working with our state chairs to continue the DACLAC meeting format that we used last quarter, with timely information shared by our state agencies and panel presentations from our 3 subcommittees, with ample time for both full committee input and public comments as well. The subcommittees are continuing to prioritize their top policy issues and recommendations leading up to our day of action in October, where they will recommend their number 1 priority for immediate action and implementation this year. We had hoped to have 2 public comment periods today, but decided that the presentation on the May revision budget proposal was timely and important to include in this meeting, and appreciate the Health and Human Services Undersecretary in joining us. So we will have 1 slightly longer 20-minute comment period at the end, and after all 3 subcommittee discussions today. And of course, as Carol and Jackie have reminded us, written comments can also be submitted at any time to the engage@aging.ca.gov site. Hagar?
Thanks, Sherry. I wanted to just thank the subcommittees and the subcommittee chairs for their participation and their work in preparing for today's panel presentations. All of the participants have been meeting and drafting and debating and returning to those recommendations to make them more specific and meaningful, and also engaging with various government agencies in order to make sure that the recommendations that they're making are relevant and useful. And I also wanted to thank all of our government agencies for participating in these panels: Department of Healthcare Services, Department of Rehab, CDA, of course, and DSS. And just, I really appreciate you coming to our subcommittee meetings and engaging with us and making these meetings so much more productive and useful in making sure that today's meeting will be productive and useful as well. As we prepare for the October Day of Action, each subcommittee prepared more specific recommendations to discuss today than what you have heard on the last DACLAC meeting. Our aim in changing the DACLAC format to a panel style was to inspire and facilitate more of a conversational style meeting so that these meetings can be more meaningful. And to that end, we invite our government agency partners to weigh in and participate in panel discussions. So I want to thank you in advance for engaging with us in this space. And then before we begin our panels, I just want to set the stage for the recommendations that you're about to hear from our various panels. We are all painfully aware of the difficult budget ahead and appreciate, as Marco mentioned, the difficult decisions that the state has had to make. To that end, our committees have been working hard to prioritize equity and community living in their recommendations. We've all considered short-term recommendations that are both responsive to and respectful of the budget and its limits. And we also are going to be presenting long-term recommendations that we hope the state will work towards in both bad low resource times and good ones, so that we're always making progress to achieve a California that has livable, inclusive communities for all Californians. And with that, I turn back to Sarah.
Great. Well, wonderful. Thank you for the introductions, and again, appreciate all the time you have put in just to thinking through how to organize all this. It does not go unnoticed. I just want to say that. So if we didn't have the work that you all do, we wouldn't have an effective committee. So at this time, I'm really pleased that we're going to turn it over to you, Hagar, to get us started on the Home and Community-Based Services Subcommittee. So thank you.
Thank you. So Carol, are you able to pin the subcommittee member, the speakers for today's panel?
Can you tell me who that would be?
Yes, we've got Janie and Michelle, and then we have Sabrina, and Megan Burke, and I.
Okay, thank you. I can.
Thank you. Great. All right, so we originally had presented some recommendations to Department of Healthcare Services and CDA around 3 major topics: access, navigation, and quality metrics. Because of the budget, we have added a first recommendation around the May revise. These are not all encompassing, but highlight 3 top priorities for the HCBS subcommittee, focusing on the services that we feel are fundamental to community living. So generally, when you're listening to our comments, we want to make sure that our priority is that the state doesn't go backwards before we look ahead in our following recommendations. So I'm going to turn it over to Michelle and Janie, and they're going to talk about our budget response.
Thank you, Heather. My name is Michelle Rousey. I'm a IHS consumer and community member and advocate on the DACLAC committee. The HCBS committee advocates for equitable access to California's home and community-based services with the purpose of advancing community living and inclusion for all older adults and people with disabilities and caregivers. The elimination of IHSS services for undocumented individuals from the governor's proposed budget moves California in the opposite direction. Instead of removing inequities and extending access for all home and community services to all, this cut would worsen health disparities for undocumented individuals, making them more susceptible to institutionalization and ask families who tend to be more economically at risk to take on more unpaid caregiving. IHSS is California's largest home and community-based service and is fundamental to helping older adults and individuals with disabilities live in their communities and outside of nursing homes. The HCBS subcommittee recommends that to truly advance community living for all Californians, the governor and the Department of Social Services make good on their promise to prioritize health and equity by reinstating IHSS services for all Californians. Thank you.
Thank you, Michelle. I'm hoping that you can maybe talk about, as an IHSS consumer, what you feel this loss of access to IHSS services for undocumented folks how that will harm that specific population. How do you see that impacting their lives?
Well, I know for me, if I was one of those persons, you know, it would put an undue burden on my family and those who are caring for me, that I would not have access to the home care that I needed and possibly be institutionalized, or even, you know, more costly expenses would be incurred by the state because I don't have the care I need at home, which is far cheaper to do. And I think it's important to remember, if we lose the home care, a lot of times we lose housing and other access to community-based services because we're now institutionalized, and it's far greater to be able to get you out later than just maintain you in the community.
Great. And I think, Janie, you had also some comments about the backup provider system cuts and the cuts to the career pathway program. I'm hoping you can talk about those and then maybe give us some idea about how you think those cuts will impact the community.
Sure, thanks, Agar, and I'm delighted to be here. My name is Janie Whiteford. I'm the current president of CECA, California IHSS Consumer Alliance. I'd like to talk first about the backup provider system that is going to be cut. We are very concerned about this. Currently, the backup system, the way it's organized now, is that backup providers get a $2 differential adjustment in the salary depending on what county they're in. Their base salary would be based on what the county has, and then $2 differential on that. The state would be discontinuing that program, and then there was just, I understand yesterday, something put in that would say that in the WIC, in the Welfare and Institutions Code, that the entire backup system would be no longer required. If we do away with the way it's organized now, the public authorities would be having to do that, but if the Welfare and Institutions Code changes, there would be no backup system whatsoever. And the backup system is used by those consumers whose provider, for whatever reason, cannot help them. And if they are in dire straits where they need to get out of bed, they need food, help with providing food resources, actually cooking their food, helping them get out of bed, doing bowel and bladder care, doing personal care, that if they are not able to get these backup services, they are definitely going to be going into having to call 911, having to go to the hospital, having to utilize the urgent care facilities that are available in the communities at a much higher cost than they would be able if they had a backup service, which would be minimal compared to having to go to the hospital or using these emergency care services. So for that reason alone, we really recommend that the urgent care be remained in place to look at this. And I think it would be really interesting to be able to do some kind of a study, or having the numbers available as to how many folks currently, because one of the things we heard in the from the legislative committee's hearings was that it's an underutilized program. Well, I think it's underutilized because it hasn't been really well advertised. Folks don't know that it's in existence. So I'm wondering how many folks now go to the hospital or use urgent care because they don't know that this system is available. And if it was available and we got the news out there, I think it would be utilized much more. Going back now into career pathways, as you know, career pathways is a program for providers to utilize over 100 different programs for training, and they are currently paid for their opportunity to take this training in different pathways. I know that they're currently, it's incredibly utilized by providers. The classes are always filled with wait lists, and we're looking at over 100 classes in many different languages. And there are some that, most of them are virtual, but there are some that are in person. And I think it's really important to note how utilized these are by providers, which tells us that providers really are looking forward to trainings to be able to enhance what they're doing for their consumers and being more educated in that arena. This program was started with some federal funds, and then the state added some additional funding to it. And the way it's progressed now is to cut that funding and take it and put it in other programs. I just think that would be such a disaster to know that all of this development has occurred in the past year, and to be able and to just close it down in September would just be such a tremendous loss. And I really would love the state to look at other opportunities for funding this program long term. It has always been a pilot program and was never to be there long term, but it is so vital and so utilized that it would be a really, I think, sad state of affairs if we can continue it. So my plea would be, where would additional funding be found? Can we look at grants? Can we look at outside sources besides state funding that might be able to continue this program? Again, let's think outside the box and see what we can utilize to make this move forward. Thank you.
I'm hoping that maybe I don't know how our government partners feel about joining in this discussion, but I think that one of the things that has been forefront in our mind is really how how do you view these cuts as impacting the implementation of the 5 goals on the master plan for aging, and also now that you're kind of listening to what the concerns are of the subcommittee around harm, I'm wondering whether you think that there are opportunities elsewhere, or how we can work together to really make sure that the affected communities are going to be supported as they lose access to services.
Hi, this is Anastasia Dodson from the Department of Healthcare Services. I want to, on the IHSS topics, I definitely want to defer to colleagues over at the Department of Social Services, but for DHCS, we really, of course, Undersecretary Meek really spoke very well about the difficult decisions, and we're very happy to continue partnering with you and pivoting. Even some of, in addition to budget changes, we have, federal policy changes that come around, regulations, et cetera. So we always want to keep in touch with you and consult with you as we need to adjust programs and able to share data and consider how to focus the resources that we do have. But I'll defer to Director Johnson.
Thank you, and good morning. Kim Johnson, Department of Social Services. I just want to appreciate that presentation and really lifting up both impact of the services as they're available today and as proposed for reduction. And so just appreciate everything that's been said. And I think just picking up on Janie's last point related to additional funding streams and resources. Glad to always think about that. We know we have several efforts, even at the federal level with the federal government, with new opportunities and funding. Is there other philanthropy? So I just really want to appreciate the point that's been lifted up there of really being able to identify and exhaust searching for alternative funding streams for any of these proposals, even those that were proposed to be one-time in nature, like IHSS career pathways. And to the point, the overarching point of the master plan, clearly we are still committed to the implementation of the master plan and very much appreciate the continued engagement with all of you and other community partners in continuing to identify how we have actualized, to Undersecretary Meach's point about all that we have accomplished together. And it is together that has helped us get further sooner. How do we look at this particular deficit in the context of that progress being made? And how do we, again, do our very best to ensure infrastructure components are in place where we can, or identify, again, other alternative resources. Again, our commitment to doing that together. So just appreciate the points being made here that we all want to really look at what has been successful and identify ways that we can further those efforts, even if it's without state general fund, pending the outcome of the budget. And again, our commitment to continuing to go further with all of you remains.
I appreciate that. Thank you. I think I'm going to move us along because there will be opportunity to discuss a little bit more in a moment. We wanted to also, we had some additional recommendations that we had been working on that we see as more long-term recommendations. So when you're hearing these, don't get upset that we are ignoring the budget situation, and keep in mind that these are recommendations that we think the state, some of them present opportunities for the state to do things now because they are low to no cost, and some of them are really an expression of our goals and where we think the state should be moving in the future as we continue to work together towards an equitable California. So I'm actually going to start with Megan because she's going to need to step away. So sorry to shuffle things last minute.
Thank you, Hagar. I think as I'm hearing this conversation around the budget cuts, it just really reinforces for me how important measuring what matters most to individuals when we think about quality measurement in improving access to HCBS and improving the program. Just again, thinking about human-centered quality metrics and how important they are to help us understand that impact when we're thinking about budget cuts. So along those lines, just really quickly, we wanted to acknowledge CMS's recent release of the HCBS access rules, and just we have a number of quality metric recommendations that we've come up with as a work group, HCBS work group, and we're happy to have future conversations when the state begins to really plan on implementing those new quality metrics. So looking forward to future conversations, but know that we want to kind of focus a little bit more on some other items today. Thank you, Hagar.
Then I think Sabrina is going to talk to us a little bit about our navigation work and recommendations around making our HCBS programs more accessible.
Thanks, Hagar. Hi, all. My name is Sabrina Epstein, she, her pronouns. I'm a policy analyst at Disability Rights California. As far as navigation, we talked about what a no wrong doors system can truly mean for working across the different HCBS services that we have throughout all the different departments represented here today and more. And just a quick overview of what our working group thinks a no wrong door system truly could mean is that it should be holistic and inclusive of all the services and supports that individuals living in a setting of their choice need. So that it would include both disability and aging specific services and more general social services, things like SNAP. It also should include community input at every stage of the design. Any opportunity for engaging stakeholders like those in this committee and beyond will only strengthen the system. It also needs to be cross-departmental because none of our lives are siloed in the way that these different state departments have been broken up. We live across these departments, and so a no wrong door system needs to work across them. In the short term, we want to encourage all of the folks here today to think about how to remove administrative burdens so that it's no longer a full-time job for disabled people and older adults to navigate these services, and to coordinate across the departments as much as possible. So that way the coordination can come across departments rather than at the individual stakeholder, individual consumer level. And lastly, we want to encourage the state to find opportunities to centralize program information and applications so that it's not as burdensome for the individual consumer to have to find so much different information across different websites and repeatedly apply and share their same information over and over again, when there could be some sharing and consolidation across different departments. Thank you.
I'm going to just go over our access recommendations, and then we're going to try to hopefully get some engagement, or if our government partners want to also weigh in and respond to these, I think that would be really helpful. We have 3 access recommendations that we feel don't require any sort of financial investment from the state. The first is a prompt coverage recommendation, and prompt coverage means that an individual who applies for and is able to is approved for HCBS services can start receiving them upon providing the completed application, rather than waiting for a plan of care to be implemented and certifications to be approved by the state. So in that kind of system, a person can start getting at least a preset batch of supportive services while waiting for applications to be approved. And that's going to be very helpful for both consumers who will be able to get services when they need them, and for providers who will be able to have the security to provide services knowing that they will be reimbursed for them. The second recommendation that we have is to implement presumptive eligibility for HCBS using 1115 authority to get individuals who are likely to qualify for Medi-Cal to start receiving HCBS services while their applications for Medi-Cal are being processed. Again, we use this authority in presumptive eligibility in hospitals, but this would be community individuals who are applying for HCBS and Medi-Cal at the same time will be able to get that Medi-Cal started while they're waiting for the application for Medi-Cal to be finalized. And finally, our last recommendation under access is around a projected cost policy, which will allow individuals who are on share of cost Medi-Cal to have their to be considered as meeting their share of cost at the first of the month instead of having to first prove that they have spent down and before starting services. This recommendation, again, will allow individuals to access services when they need them and also allow providers to get reimbursed, knowing that the individual is going to meet their share of cost by the end of each month. I'm going to stop right there. I think these are very technical. Some of these are technical, and so I want to just stop and open it up both for comments and questions from our government agency participants. I know that we've presented these before, so you've had a little bit of time to think about it, but I don't know if you wanted to make any comments on these here or engage in a conversation.
Hi, everyone. I'm Dinja with Department of Healthcare Services, specifically healthcare benefits and eligibility. Definitely want to share some of my thoughts on the presumptive eligibility pathway, as well as the share of costs recommendation from the subcommittee. So first, I definitely want to appreciate and thank you all for kind of your thoughtfulness here. And I think from the department, definitely from kind of an eligibility and enrollment perspective, we do recognize that our processes are not as streamlined as we would want them to be. I think definitely for the HCBS populations, individuals who need a certain level of care, and there is kind of that health component of the Medi-Cal application process that sometimes does take over kind of the timeliness of like the 45 days, for example. So some initial thoughts on presumptive eligibility. I think the subcommittee you guys presented that this may be of a very low cost to the state. I think for one, I think that's for us to, most of the individuals on presumptive eligibility are in the fee-for-service delivery system. And from a caseload perspective, just kind of offering that, we have looked at similar proposals in the past for different coverage populations. There is a certain potentially some costs given kind of the level of services they may need. So it's something we will have to kind of think about. The department will take that back and think about that. Just kind of looking at utilization from the HCBS population perspective historically. But there will be, I am assuming, just kind of looking at this and thinking through some of my previous experiences with PE. We've implemented like hospital PE, for example, and looking at the various coverage groups, we will anticipate a bit of utilization costs from this population. So something to just wanting to share transparently with you. That's the first thought. The second thing is definitely agree that the presumptive eligibility pathway, the simplified application, will provide some readily available services to the population. And definitely with kind of our culture of care in California, it will be through potentially the federal mechanism, probably the Section 1115. Just because right now under the California state plan, we don't have an option to, from a comparability standard, provide that under like a simple swab process to Centers for Medicare and Medicaid Services. But definitely we think a waiver potentially, and it has to be what we will call a budget neutrality mechanism if this proposal is to move forward. And in terms of the share of costs, we definitely recognize share of costs is a very difficult concept. And I think number one, we are working with California Healthcare Foundation to provide much more streamlined training materials from like a user brochure. We recognize we don't actually have something like that that's much more relevant to 2024, given all the eligibility changes in the world. So we're doing some user-focused testing, very specific to share of costs in terms of the brochure that we're going to be putting together in partnership with California Healthcare Foundation. We're actually going to do some focus group testing on it just to make sure we got the information right. We're connecting with our members in a way that it makes sense to them. So more to come on that. It is a priority for the department. And secondly, in terms of your proposal on effectuating coverage, very similar to our long-term care population. I think I understand the policy concept. We could definitely kind of take that back and think internally. It will be very similar to how we treat our income for our individuals in long-term care. They'll require some conversations with internally as well as with CMS. Again, because this would be it will potentially be a change in statute in terms of how we're going to think about this, but definitely a very creative proposal that, you know, I'm happy to take back and think internally. But that's my feedback on some of the proposals here. I know I have my colleagues here from Integrated Systems of Care, so definitely want to provide them an opportunity to also share any initial thoughts. Thank you.
Thank you, Yingzhe, and good morning, everyone. Joseph Billingsley with Department of Healthcare Services and specifically representing healthcare delivery systems and our Integrated Systems of Care division. First off, just echoing what Yingzhe said, I really just want to take a moment to appreciate the thought process behind the proposals that you've raised, and appreciate your work in taking the time to brainstorm and try and identify recommendations for solutions that the department can take back and take into consideration. So I thought Yingzhe made some really good points related to the presumptive eligibility and share of cost. So agree that those are pieces that we need to take back and look at in terms of what is potential cost impact related to these proposals. I think that what I want to stress in the interim, while we do continue to always look at how we can improve our how we implement and operationalize our programs here at Department of Healthcare Services, that also just emphasizing the work that we are doing to also improve current operations, based upon existing policy. And so really highlighting that, from an HCBS perspective, we are working really closely. One, we've been working to expand access to the waivers, some of our waivers through increases in the capacity of those waivers, also recognizing, the specific problems you're trying to solve here in terms of these waivers, in terms of timely access of services and time to access services, working to address, existing issues with the time frame behind application processes for our waivers, and really working to be able to improve those timeframes so that our members are able to access the waiver services more in a more timely manner, and then also continued work that we're doing with our waiver agencies and care coordination agencies in terms of educating them on working with the counties and beneficiaries, to use existing pathways for reducing share of cost amounts. So again, I think appreciate the proposals that you've raised, and look forward to continued engagement with you on these, but also we'll continue to work closely with you also on improving existing practices with our operations with our existing policies.
Thank you so much. I really appreciate you guys' comment, response, and consideration of these recommendations. And I'm going to turn it over to also CDA, to Sarah and Anna from DOR. I think you guys had some comments as well.
Yeah, thank you so much. I just want to say to this committee, you just started meeting a few months ago, and I'm super impressed with how you've really identified such critical system issues to prioritize and bring forward in your recommendations. So Anna Acton and I wanted to take a few minutes before the break to update you kind of on what the state's doing relative to our work to advance the development of an aging and disability no wrong door system. Really appreciate the strong partnership of the Department of Rehabilitation led by through Anna Acton's leadership. So two things, one of the priority issues in the master plan for aging is the development of a statewide no wrong door system to, just as Sabrina, you were speaking to make it easier for people to connect to the services they need in a timely and streamlined manner in a very person-centered way. Two ways to do that are through a statewide consumer-facing web portal, and second, through a contact center so that you can call. A lot of people don't want to have to go through a website. They might want to just call to have somebody to speak with. We have a number of local partners that do this. We have our, area agencies on aging. We have 211s in many areas that do this, but we know that there's no statewide platform. We need to do better for people. It is very hard for people to get the information they need when they need it. So there's two things going on right now to kind of advance this work. One, we were able to secure a grant from the Administration on Community Living to stand up a state leadership council on advancing an aging and disability no wrong door system. So CDA, as well as the Department of Rehabilitation, Department of Healthcare Services, Department of Social Services. Am I missing somebody, Anna?
Developmental Services.
Developmental Services. Thank you so much. Of course, Developmental Services. We have been meeting to kind of arc out what's the framework for how we envision and plan for a no wrong door system, which would be, again, operationalized through a web portal and a contact center. Now, it's important to point out that this is a long-term project and we don't have resources right now to stand up a web portal or a contact center, but we are starting with the planning of it. And this is really important because when you have the partnership across departments to really identify how it should look, how it should work, how it should connect with local level, to have to ensure that there is warm handoffs. We're doing the planning work that's needed to be able to actually stand something up like this when we're able to secure the resources for it. Secondarily, the Department of Aging is working to arc out kind of the business case for the development of a web portal that's, again, statewide, and that is not just about aging. It's about aging and disability, as well as housing and transportation, a connection across the system rather than just the siloed approach that we often see. So Anna, do you want to add to that? Also, Claire Ramsey is an active part of that, as well as Developmental Services and Healthcare Services, if anybody else wants to add on before we transition.
Yeah, and I know, thank you so much, Sarah. Anna Acton with the Department of Rehabilitation. I just want to thank the HCBS subcommittee for your very thoughtful, excellent work on your recommendations. And so I think that the first recommendation around navigating the system is going to fit perfectly into the State Leadership Council No Wrong Door initiative. So thank you. That will be shared. And just to kind of build on what Sarah said, we know we're in a bad budget time, but now's the time to plan. Now's the time to be innovative and creative. And so I think this is perfect timing for this work to think how we coordinate across systems. We've come together a couple times as a State Leadership Council No Wrong Door group, and we've started working on things like our vision, but also guiding principles. Like, how do we ensure people have access to the information they need to make informed decisions? How is the system going to be accessible, equitable, be able to be easily navigatable by individuals? How are we accountable with the referrals and connections and follow through? And how do we coordinate, right, to across departments, both at the state level, but also at the local level? So and also person-centered, ensuring that these systems, right, are person-centered and based on the individual's needs. So there's a lot more to say on it, but I think we'll be sharing more information over time with all of you on this. And again, thank you for your recommendations.
Great. Anybody, any other comments from any other partners? Okay, so Hagar, final closing remarks, and then I'll transition us to break.
Right. Well, I really appreciate everybody joining the subcommittee and weighing in, and yeah, looking forward to continuing our work together and to providing more input in the near future.
Wonderful.
And
Well,
yeah, I actually have to roll off, so my apologies for leaving.
no problem. Thank you so much. Why don't I turn it over to Carol? Carol, we'll transition to break. We actually don't have 15 minutes. We're a little behind. We're going to get started at 11:26. So I won't transition to Carol. I'll save our time. I'll save our time and we will just go straight to break, get some food, get some rest. See you in 10 minutes. Thank you all.
Thank you, everybody, back at 11:26. Right, Sarah?
Right.
Thank you, everyone.
Back, everyone. Thank you all for being here. I am so pleased to turn it to Anna Acton, our colleague at the Department of Rehabilitation, who's going to be facilitating our transition to the Housing Subcommittee. Welcome, Anna.
Thank you, Sarah. Welcome, everyone. Again, Anna Acton with the Department of Rehabilitation. Before I turn it over to the Housing Subcommittee, I'm going to take this moment. It was mentioned earlier that we're working on renaming the Department of Rehabilitation to the Department, the Disability Works California. Really excited about this name change. We are pending legislative approval. It's part of the May revise. But I really believe that this name articulates the work that we do to advance employment for people with disabilities, and also sets the tone and challenges our stereotypes, stigma, and misconceptions about disability, right? Disability works. It's part of the human experience, and it's something that we all experience, right? Either directly through our lived experience or indirectly through our family, our friends, and our community. So I'm really excited about that. We also, as part of our May revise, have the establishment of the Employment First office at the Department of Rehabilitation. So that will help us work with our other state partners, our community partners, to advance employment for individuals with developmental and intellectual disabilities. So I'm excited about some of the changes coming up through the state budget. So with that, I am going to turn this over to Marty Amoto, who is going to help facilitate the Housing Subcommittee portion. Marty is with the California Disability Action Network, is our Housing Subcommittee chair, and I would say just an amazing disability and aging advocate and ally in the work that we do. So thank you, Marty.
Hey, thank you, Anna, and thank you to Sarah and everyone who's been facilitating and providing presentations to this meeting. By the way, I'm going to do a shout out to DOR. There's a mutual friend of Debbie Toth and mine. She has long passed away, but a tremendous advocate. She used to always attend these meetings when it was called the Olmsted Advisory Committee. Debbie, you know what I'm talking about, right? Maggie D. Dowling. And she would have really appreciated many of the good changes that DOR is doing. She wouldn't appreciate any of the cuts being proposed in the May revise, especially to IHSS. But I just want to, I mention her name because she's with me and she's with Debbie in spirit always. She's yeah. So Debbie says she's smiling, which she sometimes does. She sometimes did. So I just want to provide a quick overview. The way we broke things down, and I think I'll turn it. I think I'm turning it back to Sherry after this, after I do a quick overview. But we had a priorities established by subject category, and on the suggestion by Hagar, we revised it to put the priorities under immediate, short-term, and longer term. And the reason we did that is because of the May revise and the urgency for us to provide feedback and also recommendations given the short time frame of the state and the legislature to act on many of the proposed cuts that impact housing. And the other category, short-term and longer term, deal with things that and again, Shella Dumont, who's on our subcommittee, will provide the overview on short term. Our proposals that deal with short term ideas and priorities that could be done to maximize existing resources or at very low cost to the state that would in fact produce longer term savings. So Sherry, am I turning it back over to you? I'm not.
Yeah,
Okay,
thank you,
thank
Marty.
you.
I think you already answered questions 1
Yeah,
and 2
thank
with your
you.
overview, so that was wonderful. Save us some time here, since we are a little bit behind schedule. So since you gave that overview of the framing that the committee has used to establish working towards the numerous priorities that the committee has recognized, how about we start off with you sharing what are some of those immediate priorities that have been identified and some of the recommendations that have been put forward by the Housing Subcommittee. And then secondly, how these immediate priorities, most of which are directly addressing the proposed delays and reductions in the state budget, how they impact people with disabilities and older adults.
Yeah, thank you very much, Sherry. So the Housing Subcommittee met on May 14th to go over these priorities. And again, there are some subcommittee members who are members of the full DACLAC committee, and they can join in and provide comments at the end of this overview. But the Housing Subcommittee recommends to the stakeholder advocates on the full DACLAC committee to advise the state and legislature not to make reductions or impose delays in implementations in the following housing programs and housing supports and services. And by the way, we recognize, all the subcommittee members and everybody on the committee recognize that many of the priorities in the other subcommittees, transportation especially, but also HCBS, home and community-based services, those priorities overlap. And as many of us have argued and advocate, a lot of the needs in HCBS or in transportation or for a person to live safely in their own home are urgent priorities as well. So that's not to not recognize those needs, and we fully embrace those. So some of the immediate priorities that we recognized and we are advising the state of California, we hope the full committee will agree with us, is the proposed cuts to Home Safe and Housing and Disability Advocacy Program, HDAP. That's under the California Department of Social Services. By the way, I have a fuller background document of all these reductions and priorities that I will send to the Department of Aging to then post, and I will also send it to all the subcommittee members. It has, the budget cuts proposed and also some other background information. Proposed cuts to HAP, the Homeless Housing Assistance and Prevention Grant Program. That's under the California Business Consumer Services and Housing Agency, the Behavioral Health Bridge Housing, Behavioral Health Continuum Infrastructure Program. Proposed cuts in IHSS, specifically we mentioned impacting people who are not documented. This is a permanent cut, ongoing cut, and we felt that it had a direct impact to support needs in the home. And then the proposed delay from July 1st, 2024 to July 1st, 2025 of the full implementation of the regional center provider rate reform increases. That includes, and so it's not necessarily all the direct care service providers have an impact for someone living in the home, but certainly there are providers within that do impact supports in the home, such as supported living services. Next slide. Or next. Thank you. And by the way, I just want to mention, I mentioned the chat, there was a big protest yesterday, attracted about over 1,500 people at the state capitol who were there protesting any delay in the rate reform increases. Kim, who's on our committee here, and myself, we were one of the speakers, along with my son, Alex, who spoke for the very first time in his life at a rally fighting for his rights. Another priority that's tied to the May revise, but not to a specific cut, is that the state identify and consider the impact of all proposed reductions and delays that impact the whole person, crossing all the systems, rather than just looking how it impacts that service or supports within a specific department budget, and also looking at the impact over a 2-year budget period. Some of this we talked about with Marco when he was on, but I think it's really, really important that we look at how an individual cut impacts an individual across all the system service areas. And also lastly, in terms of a immediate priority, is that the full committee recommend to the Master Plan for Developmental Services, which is actually under the California Health and Human Services Agency, the need to make a priority of housing related supports and services, homelessness prevention, including workers who provide supports and services, and that these issues are linked to housing and housing support related initiatives in the Master Plan for Aging. And we got to act as advocates. And I keep mentioning this because I sometimes get a little frustrated that we still talk as advocates in silos. So when we talk about the Master Plan for Aging, we got to make sure we go out of our way to welcome people with disabilities and also people with developmental disabilities and people with behavioral health needs. And don't think that just because we say and disabilities that's a welcome, because it's not. And likewise, I think the Master Plan for Aging and all the people associated with it needs to embrace and fully understand and be helpful and devoted in implementing the Master Plan for Aging. And so we need to really work as advocates, not just to press the state of California to do the right thing. We got to press ourselves as advocates to make these things work. And sometimes I get frustrated because I've been doing this for a long, long time, and it just feels like we're still in silos. So that's the last immediate priority. Sorry, Sherry. And now I'm off my pedestal, and I will turn it back to someone from the congregation, Sherry Burns.
Thanks, Marty. Lots of immediate priorities that I think everybody agrees with are devastating if those full cuts go through. Shella, who is also a very active member of the Housing Subcommittee, can you also talk about what we're calling short-term priorities and recommended action steps? What does the short-term priority mean, and how do these priorities impact an individual with disabilities and older adults and their families?
Hi, Sherry. Hello, everybody. My name is Shella Comine-Dumong, and I'm the Executive Director of Chance Housing, but also do hold a couple of other sort of stakeholder, I guess, representation areas in the state. And I just want to make clear that the short-term priorities was something that we struggled with paring down. We couldn't come up with one or two or even three. So I'm going to briefly move through what we felt the short-term priorities were, with all of them focus on maximizing our participation in existing resources, funding programs, and really to focus on achieving fair and equal participation of our folks in those systems and those resources that exist and are still operating. Over the course of the time that I've been participating on the Housing Subcommittee, some gaps and some barriers have been identified by, at all levels. And so these short-term priorities are a way of addressing those within existing programs to move affordable and accessible housing for our folks forward in these budget times. So the first is developing action steps, obviously, to break down silos, develop an inventory of state and local government services related to housing and housing supports. And I see this as harmonizing with the no wrong door approach, which is being developed as well. So this is going to be ongoing work. I hear something in the background. Is that me, or is that someone else? Is anyone else hearing that, or is that just me?
I was able to mute someone. So
okay.
Please go ahead.
Okay, great. Also, developing action steps to improve access and transparency to CalAIM, and especially their housing related supports and services, and to make these statewide. And it's self-evident why for our folks, including us fairly, in accessing housing navigation, rental assistance, security deposits, tenancy sustaining services, homelessness prevention, and housing modifications is so critical. It's critical. I've had an opportunity to review those forms, and guess who's missing? Not missing. Not specifically called out, I guess I should say. A third item is develop action steps for the state to review housing assessments and eligibility tools and forms, and make sure that we're fairly represented, that, you know, there's no problem down the road with a poorly trained staff person not, you know, unintentionally excluding our populations that need access. Next page. The fourth item is came up at the last meeting, and that was a recommendation that the state pursue alternate funding sources, specifically federal funding sources, for a pilot, a shallow rental subsidy portion that Justice in Aging had really drilled down as being incredibly important for older Californians that needed just a little bit of subsidy, and that is one way to stretch the funding. And also a recommendation, the adoption of recent low-income housing tax credit rent cap protections, which they adopted for projects going forward, but that be applied to current projects and projects in prior projects as well, if possible. Explore that. And then the last item on this page would be a recommendation of adoption of mobile home space rent protections. And of course, mobile homes for seniors were implemented and, you know, built in communities as affordable housing, but as time has gone by, the affordability of the space rent has climbed out of reach. I know in our area, it's over $1,000 a month on top of you having to buy your mobile home. So those protections in areas where rent caps and other sort of protective ordinances exist is an important tactic and step that can be followed up by the subcommittee. And next page. We recommend clarification of the residential care facility rent cap protections for the RCFEs and the ARFs, and strengthening protections from additional service costs. This is important because those kinds of care and housing settings, right, are important to the population, and people need to be protected. So the last item is that we recommend that the community care expansion, which is through the Department of Social Service funds, unspent funds, be directed to fund permanent supportive housing, as well as other publicly subsidized housing in the community. And that's it. Thank you very much.
Thank you so much, Shella. Quite a list of very, very pointed, specific recommendations, and it's very helpful for us to take a look at each of those individually, as well as the breadth and entirety. The Housing Subcommittee, Marty, also identified longer-term priorities and recommendations. How do these recommendations and these priorities impact people with disabilities and older adults who need help now with their housing and housing supports, or need help in homelessness prevention?
So thank you, Sherry, and thank you, Shella, and thank you to the subcommittee members for our last meeting and putting this all together. It has a tremendous impact. The longer term priorities which we have one listed, but it eventually probably will break up into different actual action steps as time goes on. We put it as a longer priority because given the budget projections in terms of a shortfall and all the proposed cuts, we didn't believe it was something that was doable, at least in the short term or in the current budget year when we're fighting off cuts. And also knowing that, you know, the budget committees actually, the Assembly Budget Subcommittee number 2 on Human Services is meeting sometime today. They're on call when the floor session ends to review all the May revised proposed cuts large in human services. That includes Department of Aging, Developmental Services, CalWorks, and Department of Social Services, and all the reductions that we have talked about today. And so we don't know where all these reductions got to end up at the end of the day with negotiations in the coming weeks. But somehow, as we move forward, the subcommittee, along with the committee, needs to look at the longer term priority and then see where there are pieces that can be implemented in the future. Probably the biggest one, and we again put a lot of other priorities within it, is renter protections and rent stabilization, and seek statewide funding for targeted rental assistance for acutely low-income older adults, adults with disabilities at imminent risk of homelessness. And that actually fits and addresses one of the initiatives in the master plan for aging. Having renter protections, and I say this from experience living with my son in an apartment where the rents keep increasing by hundreds of dollars every year. For people with low incomes, people with developmental disabilities, people with physical disabilities, behavioral health needs, older adults who are limited incomes, this issue is very vital about whether we can stay in our own homes. And if you can't stay in your own home and you're forced into an institutional setting, you lose your home-based community support. So it's pretty vital. And hopefully over the next year, we can kind of look at this to see if there are short-term strategies that we could fit in with with funding that's available through either CalAIM or some other entity. But right now, that's a long-term priority, and we all need to work together on it. And by the way, again, shout out to the Transportation Subcommittee and to the HCBS Subcommittee, because the priorities that you all identified, are issues that fit under our priorities as well. So I'll turn it back to you, Sherry. I think
Thanks,
we're
Marty.
still under time, so we're still
Yes,
good.
we're doing great. And now that everyone's heard from you and Shella summarizing the immediate, short-term, and long-term priorities and recommendations, this is, I think, a good time for us to ask the other housing subcommittee members who are on the DACLAC committee and other DACLAC committee members, as well as our HCD rep who's participating in the meeting today, for any additional comments on the committee's immediate, short-term, and long-term priorities and recommendations that have been.
Sherry, I just want to do a shout out to our subcommittee members, I think, that are on right now is Nina, Gabriel, Melinda, and Kim. And I hope I didn't miss anybody. So thank you.
So we're opening it up for additional comments.
Oh, Michelle.
Questions.
Go ahead, Michelle.
Thank you. Thank you, Marty, and for the housing subcommittee. I think it's so important for seniors and people with disabilities to not only get affordable housing, but have support wrapped around them to be able to maintain it. When we lose those supports in housing, it comes to institutional care, other resources that cost the state so much more. So there needs to be provisions to maintain our housing so that we don't lose it. And, and if we're homeless, that there be priorities set for housing, that we don't have to wait years on lists to be able to get affordable housing. Thank you.
Thanks, Michelle. I think we have Ayoko.
Thank you, everyone. Ayako Utsumi. I'm a consultant for the Department of Aging. And I also sit now on the Housing Subcommittee with Marty. And I wanted to thank everyone for their hard work here. And but I would like to build on one of the short-term priorities. It was the third one, action steps for the state to review housing assessment tools, including coordinated entry system. So just to build on some clarification, many regional entities use different forms altogether. So it's not just a review of the tools, but really the standardization of what questions are asked in order to determine if a person qualifies for various services. And because those questions aren't consistently or adequately asked, that's when people fall through the cracks. So I just wanted to point that out, the need for standardization across all intake systems in order to really have no wrong door. Thank you.
Yako, this is Marty. Thank you. Oh, yeah, welcome to the subcommittee. I forgot to do that. I'm so sorry. In response to your question, thank you. And I would add to that is training that needs to be done, you know, for the people doing the assessments or using the coordinated entry tools, or the people applying and the advocates who are helping them, because there is such like a person who's not trained in the right way is going to deny a person's eligibility because they're looking at the form very, very rigidly. So the issue, though, is trying to apply something statewide. We thought about that as well, and I think that is a goal. I think some of us were worried about what it would cost to do that, because we know there's always a cost attached to any study. But you're absolutely right, that needs to be done. So thank you. And I don't know if Shella or somebody else had a comment on that.
Well, I just wanted to thank Ayako for that clarification, because it's so important and it transcends, actually, it's not just coordinated entry, it's all of the different programs and agencies. And it's very detailed work, but the devil is in the details. And if we're going to participate fairly and equally, it's work that has to happen, and it might as well happen now, while no one is proposing and putting forward big, transformative projects to meet our needs otherwise. Thank you.
Yeah, this is Sherry. It also fits in extremely well, Ayako, in our overarching theme of no wrong door and breaking down those silos. So thank you for mentioning that. Important. Melinda.
All right. Well, hello, everyone. Melinda Forsty with Serving Seniors in San Diego. I'm part of the Housing Subcommittee. And thank you, Shella, Sherry, and Marty for presenting our priorities. I just wanted to touch on specifically my support for around the rental subsidies and the proposed legislation around that, SB 37. Serving Seniors had conducted an extensive study back in 2021 that really demonstrated that a few $100s of rental assistance a month would have kept hundreds, if not thousands, of older adults and other individuals with disabilities housed. And I also just wanted to share the success that San Diego has had. We've had pilot programs both at the city and county level, and we are seeing incredible success with those programs. So just again, wanted to plug. We know that these programs have been launched in other municipalities across the state, but a statewide program really could have a huge impact. So thank you.
Thank you, Melinda. Pat.
Well, I actually was going to put my 2 cents in for that short-term recommendation about the subsidies. I think that for maintaining folks in their home, particularly elders or individuals with disabilities, being able to kind of help them bridge a short period or a limited amount of, we know it's much more costly and much more harmful if they end up having to leave their home and then we're having a much more complicated process to getting them back into something that's a safe environment. So I just basically wanted to offer that comment and support that as a short-term priority. Would be interested in hearing more about how it's being implemented, how folks get access to it. So I may be following up with you, Melinda.
Yeah, and I just want to say also that the concept of prevention is key. It does allow people to be maintained in their own home, to age in place, and it's much easier to prevent homelessness than it is to try and bring all of the resources to bear after the fact. It's a critical component, and we should be working on that in the short term diligently. Thank you.
Absolutely. Thank you, Shella, and thank you, Pat. Andrea.
Hello. Enjoying the presentation. So I had a couple of questions.
The budget, I don't know anything about the budget. I don't know if it's something they discussed previous meetings. And these are just comments, and maybe I can get this information later. And it's so sad to hear about the cuts in regards to IHS services and career pathway. I think I was very instrumental on that. And so I'm just trying to get up to date on that information. Also, how can I become a member on the subcommittee for community-based services and home? I feel like I'll be very instrumental, especially being a consumer that use a lot of these different programs, and also having a IHS provider in regards to how these cuts could affect her and other people. I know in regards to the career pathway. And then also, I think is a really good idea in regards to coordinating services across agencies, because it is really challenging for a person to have to work with these different agencies to get different things done, whether it's Medicare, Medicaid, in-home supportive services, food stamps, and there's an application process for each one of these. And then not only that, there's a waiting time for that. And you also have people that get these services that have a hard time keeping the services because it's hard to go through the recertification every year. So that would be a great idea in regards to coordinating services across, across agencies. So those are my comments. But if somebody can reach out to me in regards to the budget, maybe I missed the email, and then also how I can also serve on one of the subcommittee, because again, I would be very instrumental along with the other consumers, because we use these services. And so we kind of know, what works. And then also having other people that share these services with us can also, partner with other agencies to kind of make sure they are working for the folks that's using it. So thank you.
Thank you, Andrea. And you can put your contact information perhaps in the chat. And then I'll also pass on that your interest about the HCBS subcommittee to Hagar, and she's chairing that committee. I'll let her know that you're interested. Yeah, thank you. Joe.
Well, hello, everyone. I'm new to the committee. It is an honor to be here with all of you and being part of this amazing committee. I'm also a part of the Developmental Services Master Plan as well. My name is Joe Perales. I'm the director of ALARCTA California at the Arc of California, and it's an absolute thrill to be here with all of you. One thing that I do want to add, working for the regional center system for 28 years, it gave me the leverage to be involved with the people with disabilities community, but specifically for the Latino disability community. Out of the 417,000 people with disabilities that regional centers provide services, 87,000 are Latinos. So out of the 7,000, over 54% are undocumented. So there is a huge gap there in between people who are undocumented that have the need for housing. And talking to them over the years, the main priority is to have some type of emergency housing. They don't have the useful papers to be in the United States, but they still part of the system. And how can we provide supports and needs to provide the adequate homes and housing for these population? And emergency housing is a thing that is really important to them. And also the traditional housing, they want to be supported. They want services and assistance to be helping them as they transition into long-term solutions. Accessibility is important for a lot of the Latino disability community to have the supports with accessibility to wheelchairs, ramps, accessibility to bathrooms. A lot of the community, they don't have the funds or the means to provide for these supports. So going through the system itself to find these services available to them. Also, stability, that eventually they want support for the stability like everybody else, and live in an environment where everyone is welcome. Right now, the Latino disability disability community, it feels neglected in a lot of ways. There's a lot of gaps in between that we need to address this issue at a statewide. I just want to add that to be part of the long-term and short-term goals that we establish in here, and primarily in the housing area.
Thank you so much, Joe. You know, if we're viewing community-based, affordable, and accessible housing through a lens of justice, equity, diversity, and inclusion, we cannot leave out the Latino community. And it was not part of the conversation until you mentioned it. I want to thank you for it, and lesson learned on my part. So thank you, Joe.
My pleasure.
Thank you, everyone, for your comments and recommendations. Appreciate the discussion. Marty, I'm going to send it back to you. Do you have any closing thoughts from the priorities that we presented, as well as some of the comments and discussion items as far as next steps?
Hey, thank you, Sherry, and Joe and Andrea, welcome. And Joe and I and Shella, and I think Kim is on. We served together on the Master Plan for Developmental Services, and actually Joe and I were on the same table. So, but I really appreciate your comments, and I do think one of the things that actually Marco had mentioned at the Master Plan, but he alluded to today, was the need to really on the issues of equity, and I do believe there's a need to have the new Chief Equity Officer with the California Health and Human Services Agency, who did speak to the Master Plan and talked about the issues of equity. His name is Dan Torres. I think he's definitely needed to speak to our full committee in August. And I also think, by the way, I serve on the Elder and Disability Justice Coordinating Council. I also think the Chief Equity Officer should speak there too, because I think there's a need for us to totally embrace and understand what equity is as we work with each other, but also the issues of engaging with communities who speak different languages, are different colors, and or have different other needs across California, so that they feel welcome and included. And I just want to say that the challenge before us, we're the good guys, in every instance, but it doesn't mean we always don't have challenges before us to do the right thing. So we always have to question ourselves, and I've done that for 25 years. And I just think there's a need for us to question and to challenge ourselves to do better on the issues of equity. And so that's not a request that we have that officer there. It is something that we need to do, and that I will keep pressing that we have the equity officer give a presentation at our next DACLAC meeting, because if we're going to talk about priorities, then let's actually start acting in a way that that we all engage in that way, and also we hear what the state is doing, what we all should be doing together. It's not just one group that needs to do it; it's all of us together. So that needs to happen before we do the day of action. I don't want to hear like, oh, we can't do it. We need to make that happen, and we need to have it on the Elder Justice Coordinating Council as well. So that's not a request; it's a need, and so I put it out there. Lastly, I just want to say on the issue of homelessness prevention, and as a person who's been active in my life since 1966, believe it or not, but as a statewide advocate for 25 years, I had an older sister with developmental disabilities, and also now a son with developmental disabilities and physical, and he had IHSS protective supervision. A couple of weeks ago, near our home, we walked to the grocery store, and I saw a man, African-American man, and he just kind of said my son's name. Are you Jason's dad? But I didn't know he was talking to me, so I just passed him by, thinking he was just delirious. I saw him 2 days later, and in a shopping cart, and he said that again. Are you Jason's dad? Jason's my older son. And I stopped and realized he was talking to me, and he was clearly homeless. And I went up to him, I said, yes. He says, you don't remember me, but my name is Andre, and I went to school with your son. And I said, I remember you now. He went to grade school all the way to high school. He's homeless. He has developmental disability. He has disabilities. And he didn't ask me for anything. I gave him money, but he didn't ask me for anything. And then he went back to the dumpster in the parking lot, And I walked back over there and I gave him $20, which I don't normally do. And laying down next to him was someone I finally recognized that I've seen for 5 years, but the way he was positioned, because he was laying his head on his elbow, I recognized that man that I provided direct services to as a direct care worker 44 years ago here in Sacramento at a program. His name is Leonard. And there he was, homeless, out on the street. I've been seeing him for 5 years, but I didn't recognize him until he was laying down that way. And I said his name, Leonard. And then he looked at me. And there were 2 generations of individuals together. They didn't actually know each other, but they were together, who are homeless. And is anybody tracking them and knowing where they are? I don't think so, because I've seen that guy on the street for 5 years. And so I'm just saying from personal experience, these are 2 individuals that I know, and that I provided services to as a direct care worker 44 years ago, and he's on the street. So this is all about individuals and people that we see every day. And so all these priorities that we talk about, we always need to remind ourselves, and I'm sure we do constantly, that this is about people. Like Andrea, thank you for your comments, because I think you did your best to mention that again. And so we need you on the housing subcommittee. I'm gonna steal you. And I just want to thank everybody, Sherry and everybody, Sarah and the team, for allowing us to talk about these issues today. And then I know we're going to head over to transportation, and shout out to my friends over there, and we embrace those priorities as well. Thank you.
Thank you so much. Thank you, Marty, for lifting up the individuals, and for the housing subcommittee for your recommendations. There is a lot of work to be done in this area. And one of the pieces I'll share quickly before going to the transportation subcommittee is the work that we're doing with the Housing and Services Partnership Accelerator. So this is an initiative between Health and Human Services, Department of Healthcare Services, California Business Consumer Services and Housing Agency, Department of Rehab, Department of Aging, Department of Social Services, and local partners like bringing in the regional housing authorities, and other service providers that are providing direct services, including our continuums of care and our emergency homeless emergency response system. And the reason I want to bring this up here is because the recommendations, some of the recommendations here are directly related to the work that we're trying to advance across departments as part of this accelerator. We're working with about 12 states throughout the country and the Administration on Community Living to look at how we leverage things like CalAIM and our 1115 demonstrations and 1915B waivers, and really looking at how we can deepen and expand the cross-sector partnership at both the state level and the local level to better leverage our collective resources between health and housing services to meet the whole person needs of people with disabilities and older adults who are either at risk of homelessness or who are homeless. The stories that Marty told, those are 2 of many that I think all of us can relate to and have seen. And so we're really looking at deepening that alignment. How do we build the capacity of our aging and disability network providers to work with CalAIM, to work with the coordinated entry systems to advance housing? I think there's a lot of opportunity there. We can definitely take some of those recommendations through the work that we're doing there. We have the California Interagency Council on Homelessness that's developing their action plan right now. There's opportunity for us to look at how we can advance some of these, cross-pollinate, right, to advance some of these initiatives. We know that 47, almost 50% of individuals who are homeless are people with disabilities. And we know that the largest growing population of homeless individuals are older adults, right? So this work, there's a lot of work here to be done. So with that, and I know we want to move over to the transportation subcommittee, and I want to introduce Michelle Rousey, our transportation subcommittee chair. Michelle, you are a wonderful advocate, and I'm really looking forward to hearing the work of the transportation subcommittee. So I'll hand it over to you.
Thank you, Anna. I'm not going to take up a lot of time, and I'm going to push it back to you. But I want to thank the subcommittee, the transportation subcommittee, and all the work that we've been doing with the partners of the staff from the state and elsewhere. And if we can move it over to have Adina do her presentation, and if we could do an introduction, that would be good. Thank you. Actually, Kayla, Mark from San Luis Bay Area, let's go ahead and go into our presentation. Thank you. And thank you, guys.
Hi. Hi, Michelle. Thank you. I think Adina and one of our other panelists.
Yeah, I think we're gonna, this is Sherry Kaleo. I think we're gonna start with Adina and some other members of the panel to share an overview of what the Transportation Subcommittee's been doing to develop recommendations to advance the master plan for aging. To kick us off.
Hey everyone, this is Jackie Tompkins. I think, oh, maybe Adina was just moved. She was on the attendee side, so hopefully she is converted over to the panelist side.
Okay, yes, I have just been converted into a panelist, and there are a few more of our panelists who may be standing by, who will need to be promoted as well in order to be able to participate in the panel. And I'm going to call them out to start with, and then we'll get started. So we're going to have also for the panel, Francis Diaz-Sanchez and John Cunningham. If they are here, they should be promoted as well. And then Christine Fitzgerald and Andy Walker, Christine Fitzgerald of Silicon Valley Independent Living Center, and Andy Walker of CalITP. They will have panelist roles as well.
They have been identified and promoted over. Go ahead.
All right, fantastic. So I wanted to start by going over what the DACLAC Transportation Subcommittee has been doing to come forward with recommendations for the implementation of the master plan for aging transportation initiatives. And then we'll talk specifically about two families of recommendations that the group has come forward with as recommendations to bring to the event in September. So the master plan for aging has a number of transportation initiatives around leveraging state and federal funding, enhancing transportation project decision-making, expanding integrated and accessible transportation through consolidated transportation agencies and fare integration, improving walkability and pedestrian safety, and more accessible and connected transportation options, as well as supporting local and regional energy programs, supporting on transportation solutions for older adults and people with disabilities. And so myself with Seamless Bay Area and Kaleo, my colleague on the call, what we have been doing in support of Michelle Rousey as the chair and with the group as a whole has been, next slide. The next slide is an eye chart. You do not need to read it, and you certainly don't need to remember it, but has been to go through the different items in those initiatives and bring forward speakers who can lead presentations and discussions to dive into those issues. And then with that information, the group then subsequently meets, discusses them, and comes up with recommendations to address those initiatives. And so what you can see here is a sequence of some speakers that have already presented, some recommendations that have already been made, and what the queue is going forward for additional topics. Next slide. And what we're going to do today is to discuss two different families of recommendations. One is some really critical near-term needs and opportunities around funding. Obviously, funding has been a major theme of this call today, and we'll talk about what those near-term recommendations are. And then after this, stay on the slide, please. We will talk about recommendations that the group has made on the topic of streamlining benefits, eligibility, and transit payment, which is also in line with that theme of the no wrong door and coordinated services that has come up on other themes on this call today. So in terms of the funding, the one bright spot, please do not forward the slide. Go back to the previous slide, please. Yes. So the transportation side has not been so steeply impacted by this budget funding cuts, but the funding has been for a long time not good. And one of the things that we realized in working on these issues is that nobody knows. Nobody knows is an utter mystery as to what are the costs and what are the funding needs to provide accessible transportation in the state of California. So fortunately, there are 2 ongoing state initiatives required by recent state laws to assess the funding needs for transportation in the state of California. So Senate Bill 1121 that passed in 2022 and Senate Bill 125, which was the budget legislation in 2023, have complementary initiatives. One of them requires the California Transportation Commission to prepare a needs assessment of the cost to operate and maintain and increase the state and local transportation system, the entire transportation system in the state of California. And SB 125 requires CalSTA to convene a transit transformation task force to develop recommendations relating to transit funding and growing transit ridership. And so our recommendations from the DACLAC Transportation Subcommittee is that these initiatives should assess and recommend funding to deliver accessible transportation, as well as on a policy perspective to implement recommendations about improving accessible transportation from multiple previous state studies. So use those ongoing initiatives to determine the funding needs and make policy recommendations about delivering the funding and improving the service. Next slide. Then there are 2 recommendations that are about not about new funding, but about better utilizing existing funding. One of them is regarding the coordinated plans, which are required for regions to develop that are intended to guide federal funding. And what we realized in doing some research is that there are sometimes not full alignment between these coordinated plans and how the money gets spent. And so a recommendation is to improve that alignment. And likewise, there are some challenges with the state funding that should also be governed by the coordinated plans. And so those are the recommendations to make sure that the state and federal funding are guided by the coordinated plans that regions are already developing to deliver and improve accessible transportation for people with disabilities and seniors. Next slide, and we'll just discuss and have Q&A on that topic. Now moving to the second topic of recommendations. This relates to the recommendations in the master plan for aging about reduced fares and easing transit payment and benefits eligibility. And fortunately, the California Integrated Travel Project, which is a statewide program has been making progress on making transit travel payment simpler and more cost effective. It enables people to pay for transit using their credit and debit card and to get access to the discounts and benefits to which they are entitled when they pay for transit. A big piece of the CalITP project is a web application that helps to streamline eligibility verification so that people can get access to the benefits to which they are entitled. And CalITP is working on standardizing eligibility requirements across the state so that people are much less impacted by having to qualify in different ways and different times and places for the benefits to which they are entitled. Next slide. And so the recommendations that the group came up with after receiving presentations and discussing is for Caltrans to set statewide definitions for people eligible for benefits, create a digital source of truth to determine eligibility, to require transit operators getting state funding to honor that eligibility, and then additional recommendations from the group identified a gap in what CalITP was already working on and recommended creating a standard definition of a caregiver, because caregivers are people who need special benefits and pricing to use transportation along with the people to whom they are giving care. And another item that was important to the group that we'll hear about is continuing to allow cash payment until and unless there's ubiquitous and convenient alternative options for people who are unbanked and underbanked. And we also had some recommendations for agencies to support that open payment and eligibility verification, and for regional coordination authorities to, where they exist, to require the eligibility from the centralized source. So that's the summary of the recommendations. I think I should have waited for Sherry to give some prompts, and I think I forgot to do that. I apologize,
That's
Sherry.
okay. You went right through everything, so that gets us back on schedule here, Adina. Really appreciate it. I think we have the rest of the subcommittee also available for a panel discussion and to go into a little bit more in depth some of these recommendations, both on the funding end as well as the benefits end. They've been moved into the panel, so you want to go ahead and bring in John, Francis, and Christine into the conversation, that would be great.
Yes, so I want to start with the recommendations about the funding. And Francis and John, I would like, in addition to what I had said, would welcome any update from Francis and any additional clarity and comment from John about the coverage of accessible transportation in the state funding assessments and doing a better job of matching up state and federal funding with the regional plans that exist. Maybe we'll start with Francis.
Hi, good afternoon, everyone. My name is Francis Diaz-Sanchez, and I am the program manager for the Senate Bill 1121 State and Local Needs Transportation, or State and Local Transportation Needs Assessment. We are currently undertaking, as Adina said, a statewide needs assessment for the state of California. And in our interim report, we did identify that accessibility was something that we could definitely discuss more and cover in the full needs assessment, which is what I am currently working on with our consultant. It is a gap, and I think after sitting in a few of the DACLAC meetings, Adina, that you have had invited me to, and upon receiving the email from Mark on the blueprint, the draft blueprint you provided, it is something that I and a few other of my colleagues are more than happy to work with DACLAC in identifying how we can really discuss again, this gap of accessibility in our report. You know, the intent of our needs assessment is to talk about what our needs are and what our projected revenues is going to be 10 years out and what that gap is, but we are also looking to discuss like what needs to be done better in terms of talking about transportation for everyone, like all users. And so, and also other impacts. So in addition to accessibility, you know, we have these climate challenges that, you know, we didn't foresee as well. So these are just things that we're looking back at our prior needs assessment where, you know, it wasn't really discussed. We know that there are needs beyond just paratransit. You know, that's just one thing that has been covered in the past, but it does not encompass, you know, the depth of what is really needed out there, in particular with our growing aging population, because as someone who took a lot of like demographic coursework when I was younger, and seeing the baby boomer generation about 15 years ago coming up to retirement and aging, we know that we are going to have a very increased need in that capacity. I mean, it's here already, but you know, it will only continue to grow as time goes on. So it's really just kind of, I think, was it not exemplified, but amplified sort of in these near-term years. And so that's something that we are working with Adina on in that capacity. I did want to provide an update. I will be sending out a second email blast with our registration for our policy recommendation workshops. We have one coming up on May 30th. It is based in Los Angeles. However, it is a hybrid format. And so you can register virtually online, and we will also be hosting an in-person workshop, or I should say a second hybrid workshop in Sacramento on June 18th. So it will be in person and virtual as well. It is the same exact format, but I will send that information to Adina to share with everyone directly too, because I don't think everyone is on my stakeholder list. And I also wanted to state that like I am more than happy to come and discuss with you the policy recommendations, the kind of what went on in both the workshops after they happened and any time thereafter as we work on releasing a working draft and also our public draft. So we're going to have, you know, a rough draft essentially out for public comment in August, hopefully, and then, you know, a much more refined draft in October. The full needs assessment must be submitted to the legislature by January 1st, 2025, as required under Senate Bill 1121. And to tie this with Senate Bill 125, the thing that we're doing is providing a broad, again, assessment on what our 10-year transportation revenue outlook is, with consideration on zero emission vehicle impact on that side in terms of how that's been affecting our gas tax and also increased fuel economy. Because as many of you know, for general transportation, most of our funding comes from the state excise gas tax. Many regions have additional sales tax measures to try to supplement, you know, their need as well. And then with 125, they're looking at what to do with the TDA. So we are evaluating transit operations and what that looks like as a roll-up in our effort, but that's kind of how it ties or intersects with Senate Bill 125.
Okay.
So, yeah.
All right. Thank you very much. And I'm glad that this is being considered and look forward to working with Michelle to, bring you back and have a discussion about the recommendations. Wanted to check if John had anything to add about the funding assessments or about the funding alignment of the federal and state sources before we go to also hearing from Christine and Andy about the CalITP payment and eligibility recommendations.
Yeah, thank you, Adina. I just have some quick comments. Again, my name is John Cunningham. I'm a transportation planner with Contra Costa County. I would like to take a moment to thank Francis for her work on this, and as well her colleague Bridget Driller. Their engagement on aging and disabled transportation issues is a relief. So thanks again. Adina, you accurately described the opportunity presented by both the SB 1121 and SB 125 processes to address what is really a long-standing gap in the state transportation structure governance funding. The gap is well documented. It's a known over 20 years and 6 studies. The state has studied this and come up with recommendations that haven't been implemented. The last opportunity to address this was the Master Plan for Aging, which transportation advocates were very excited about. However, that effort in the transportation realm, at least, fell flat, frankly, to put it politely. But back to the current issue with SB 1121 and SB 125, we do need to leverage these opportunities. We need to jump on right now because this is sort of the next best time to get the state to address this substantively. The county has transmitted a letter highlighting this to our delegation. However, we're just one county out of 58. And so without some proactivity and pressure from advocates in the rest of the counties, I can see how this might get pushed aside through in both processes, just because there are much larger issues at play, frankly, statewide. The entire public transit industry, not just accessible transportation industry, is in dire straits from a funding and governance standpoint. And then to your last point, the funding alignment, Adina, with the state and federal policies combined with the funding, it's pretty incoherent right now. I guess I'll leave it there, and it really needs to be addressed. In addition to the, I think, additional funding that is justified, and that's not just me saying it. Several state studies have said, hey, we need more funding for the service area. You really need to tie state policies and federal policies to how those monies are spent, just, being responsible to the taxpayers. And that is not happening right now. There is almost a complete disconnect between adopted policies and expenditures that are taking place. And so not only do we have limited funds, but those limited funds aren't being spent according to adopted policies. And so I'll stop there, but I'll stick around and happy to answer any questions. Thank you for the opportunity.
All right, thanks. And I want to switch to the second topic of recommendations. And first I want to go to Christine. Christine, if you want to speak to any of the committee's recommendations, including what the committee did to elevate the caregiver issue, or the longstanding need to make it easier to get access to the benefits to which people are eligible.
Sure. So some of the biggest challenges in trying to negotiate the different transportation services throughout the region and throughout California has always been eligibility, and how do I acquire the eligibility? Where do I go? What do I do? How can we make it streamlined? That's one of the biggest things we talked about in the group, and the idea was to make it basically a one-stop shop, if you will. So if you sign up through your paratransit system to access paratransit, that information can not only be shared with other paratransit services throughout California, but can also be shared with the other transportation services so that you can get the benefits of their disability discount. Whereas before you would have to go through a repeated long and drawn out process repeatedly in order to get that same service. And the one of the biggest things is to try and make this whole process easier for everybody, but also looking at caregivers. And there is no standard right now as to who they are, where they are, how they're recognized as caregivers for those that need them. And so they're not given an equal representation so to speak, with the different transportation services. So for instance, if I were to pardon me, here in Santa Clara County, a caregiver would be recognized as a caregiver and would not be charged on paratransit rides, but in some cases are being charged for transit rides, where the person that has the transit pass doesn't get charged. So there needs to be a level of understanding as to who these caregivers are, and really looking at their ability to pay if they needed to pay, and really can we possibly make it so they don't have to pay. So we can really recognize the extreme importance of their job and make it easier for everybody to take advantage of all these things and be able to move freely throughout California.
All right. Thank you very much. And wanted to open it up to Andy Walker for CalITP to add anything that might be essential in regarding these recommendations before we're going to have 9 minutes to 12:45 for the Q&A. And it's just really good to see the amount of progress that CalITP has made over the last year in a way that has made these recommendations really timely and relevant.
Hello. Yeah, I'm the product lead for CalITP benefits. And yeah, I think that Adina, you provided a great overview of what CalITP does. We're also working, of course, to implement contactless payment throughout the state as a first step, which is a prerequisite for using benefits, and also providing support for smaller agencies to offer real-time updates and data for riders so that riding trends is more predictable. But regarding benefits, we've seen amongst the 250 plus transit agencies across California, if we simply look at an older adult benefit, the age, for example, varies widely, with as little as like 55 up to 80. And so one of the things that we really see as a real potential of our product is that we can standardize that definition of eligibility for seniors and for all of the different demographics that we support in the application. And we're also interested in automating eligibility checks so that can be done online rather than in person. But we obviously need electronic ways to check that eligibility. And so along with, then standardized policy, we need the statewide, resource to check eligibility and have that be, reciprocity throughout the state, right? So that a transit rider, even within a region, doesn't have to register at multiple operators and can simply ride transit easily with where they are or throughout the state as a whole. So
yeah, Doug. Yeah, thanks for all of that progress. I think we have until hour 45 for any questions. And if you have questions that we do not get to live, please put them into chat and we'll address them to the panelists offline. Any more questions? And in particular, if Stephanie and Mark from CalSTA wanted to share as well, that would be especially welcome. Can raise your hand or put a comment or question in the chat.
I have a question, Adina, and it's more for John and the funding and where, if at all, is there policy being made now or recommendations towards getting funding so that we can get a coordinated system going around the state, if any? Because I know we had bills that we were supporting last year, and I know the 2 new bills are here, but what, if anything, is needed going forward?
Yeah, good question. I'll provide a broad comment, and then I hope Adina can fill in the specifics. The two processes that are underway in response to state legislation, that's SB 125 and SB 1121, both of those processes have a large menu of tasks that they're supposed to undertake to address both transit and broader transportation issues. One single minor item on those long menus is to address accessibility issues. And so what has to happen is that there needs to be pressure put on both of those processes to say, hey, take this accessibility item that's on your, long list of menu items and make sure this is a must do, because I'm sure they're going to prioritize those menu items, and there's going to be some must do's, some nice to haves, and there's probably also going to be some items that are, it's just not going to happen this time around. We'll get you next time. And again, call back to the master plan for aging. That's what happened to the transportation item during the master plan for aging. Sorry, it's not going to happen this time around. So I think we should learn our lesson from the master plan and put the pressure on the 1121 and SB and 125 processes to make sure that accessibility is prioritized.
We can't afford to be pushing it off any more years. This has been pushed off too much, and I think it's important for people on the committee to understand of how many years that they have been doing that, and that it now needs to stand that accessible transportation around the state is important and it's a priority, and it needs to stay a high priority going forward.
Okay, so I see that Andrea Roberts has a hand and Jeff Tom. And we have until 12:45.
Okay, just real quickly, so it's nice to see all the different services that you all are talking about. I know for me, sometime when you're doing paratransit or transportation, it would be so nice at some point that they can streamline it, because almost every month I'm recertifying for something. In regards to transportation, it's like if you get access, you have to apply for that and recertify for that. If you're getting these other services, and it makes it so hard, because in the real world, it's like if you're getting all these services, it's like every month you recertifying or you applying for all these different services, and it can become overwhelming. So it would be so nice if there's some way that if a person is getting access, then they can also, apply for Dollar Ride or, let me see, San Bernardino Transit Services under one application. Because all these transportation services, you have to apply individual, and then you have to recertify every year individual. So again, somebody had mentioned coordinating services in regards to these different agencies. It would be nice also to see that the different transportation agency can also somehow be able to streamline one application for all these services. So you only have to apply, one time. And then the other thing is that for people that's getting access, it's really hard to, it's a paratransit service. There's not a lot of places where you can get your coupons. You literally have to go, so I'm in LA County, you literally have to go into like LA to get your, tickets, or you have to apply online. Other services, sometimes they offer it through, Claremont City, because I live in Claremont. You can go and get tickets for some transportation services. And so it would be so helpful if we had more options in regard to getting, the tickets we need. And I think Christina mentioned real quick that, God, what did she say? I can't even remember it. I lost my train of thought that quick. But yeah, when you're getting these services, we kind of see a lot of the challenges in regard to keeping them recertifying, or being able to put these services together.
Yeah, those are really, really, really important points that verify and complement what was just said. And let's see, Jeff Tom.
Adina,
Go
we
ahead.
are out of time. I'm afraid, but I would like Jeff to make a quick comment and
Yeah,
have time
this will
for
be
Stephanie
very,
to make a quick comment too, so we can open it up for public
this will be
comments. Thank
very
you.
quick,
Yeah.
probably a yes or no question. To oops, sorry, to Andy, do I assume correctly that once we develop the type of infrastructure we need for statewide eligibility or fairs or whatever the topic may be, that we'd require legislation to implement that sort of thing, state legislation?
I
Is
would
that not-
guess. Yeah, I would guess, yes.
Okay, thank you
Yeah.
very much.
Thank you. And one last word from Stephanie before we send it back to Anna and Carol. Thank you, Stephanie.
Yeah, thank you. And do not want to take too much time, but did want to chime in and say really appreciate the recommendations and the continued work that's happening in the transportation subcommittee, as well as this group more broadly. And just really appreciate hearing the recommendations, really thinking about how it folds into the work that we are doing at CalSTA, where really our priority is around creating a safe, accessible, reliable, and equitable transportation system. So really look forward to taking this back into our continuing conversations and work with our departments, including Caltrans and the California Transportation Commission. Did want to mention the next meeting of the SB 125, the Transit Transformation Task Force, is on June 17th in San Francisco. So certainly invite people to join in person or virtually. There is a remote option to really stay kind of abreast of what the task force is discussing and provide input to that process as well.
Thank you. And thank you for joining us, Stephanie. Really appreciate you being here and part of this discussion. I think we're going to send it back now to Carol to open for our public comment period.
Thank you. This is Anna. I'm just going to quickly thank everyone from the subcommittee for their excellent recommendations. I think, Stephanie, you really summarized that well and did a great wrap up. So thank you for being here and your participation. And I will turn it over to Carol.
Thank you, Anna. This is our public comment period. Thank you for sticking with us. We've had quite a lot on our agenda and running a little bit behind. So, but we've had great discussions. So thank you so much. If any of our public attendees would like to make a public comment at this time, please, if you're appearing by phone, *9, and it'll raise your hand, or you may, if you're on Zoom, you can use your Zoom icon, raised hand icon. And I do see Beth Burt has her hand up. Beth, go ahead. I think you can unmute.
Hi, thank you. Beth Burt from the Autism Society Inland Empire, also a parent of 2 young men with disabilities. I also sit on the subcommittee for housing and then the master plan, the DDS master plan. So I really just wanted to thank you all. You could tell that there's been a lot of work and a lot of thought that has gone into this. I'm inspired as DDS is working through their master plan to lean on a lot of the work that you've done. And I just thank you from the bottom of my heart and our community for all the work that you've done and the thoughtfulness to keep it very person-centered and whole family-centered. So thank you.
Thank you, Beth. This is our public comment time. Thank you again for sticking with us. We've ran a bit behind on our agenda, but as you can see, it was a packed agenda. Feel free to raise your hand, *9 if you're by phone, or using your Zoom functions, you can click your raised hand icon. Okay, and of course, at any time, if you would like to mail written comments, you may email it to us at engage, ENGAGE at aging.ca.gov. And we will make sure that your written comments get wherever they need to go, to this committee, to a subcommittee, wherever you have indicated your public comment may impact. So I don't see any more comments. I'm going to spotlight Sarah Steenhausen. And Sarah?
Great. Well, thank you, Carol, and thank you for an amazing subcommittee discussion across HCBS, housing and transportation. I think that the work you all have done, I'm just amazed and proud of it. You have truly, as Marco said, been a working committee. And just want to let you know that very soon in the next few weeks, we will have the registration links out and available for our day of action on October 8th, which of course, all of you, we expect to have there, hopefully in person, if you're able to make it to Sacramento. So just be on the lookout for more information on that. I am super, super pleased that we are able to be joined at the tail end of our meeting by the wonderful Department of Rehabilitation Director, Joe Xavier. Joe has been an incredible partner for this committee, for our work on advancing the master plan for aging, for aligning aging and disability. And he's been on this committee since its very beginning in 2005. And I remember because I got to work with him in this role when I was at the Health and Human Services Agency. Always has been kind of a really good guiding guide in how we advance these issues and think about what matters most to older adults and people with disabilities. So with that, Joe, welcome, and thank you for closing us out.
So thank you for those very kind words. And first of all, my apology to the members. I was not able to be here with you outset. It's the sign of the times that we're in with many conflicting schedules. Again, let me add my appreciation for all of the work that the committee, the committee members, the members at large have been doing to continue to have impact. The work that each of you are doing, the work that we're collectively doing every single day is positively impacting the lives of people with disabilities. And while we have a long way to go, it's important to recognize we have been making progress. To the team that is supporting the committee, thank you. I very much appreciate the work that you do to bring us together so we can have these continued conversations. And then finally, just want to wish everyone a safe and restful Memorial Day that is just around the corner, and a restful summer. And we will be catching up with you at the next meeting. Sarah, I'll give it back to you.
All right. Well, with that, I want to recognize the work of our subcommittee chairs, Hagar and Sherry. You are amazing. This was like a second job for them, I think, these past, and for our subcommittee chairs, Marty, Michelle, and Hagar as subcommittee chair too. So, and I also just want to say we have an amazing staff here. Carol, you are an incredible engagement manager. Rosie did all the coordination for this. And of course, Jackie in leading the MPA as project director. I am just so fortunate to get to work with such an amazing team. So thank you all and look forward to our next meeting. But I know that all the work happens in between meetings. So we will be in touch and just a great appreciation. And let's just keep moving forward. Thanks, everyone.